When it comes to climate change, I haven't been involved in many discussions at all. You know, my focus has been in controlling diseases on Guam, you know, for our population, dealing with preparedness, you know, and response at that level. What is it going to mean, you know, in, you know, the next day and month and year, and just ensuring that we have enough supplies, you know, to meet the challenges daily. What capacity, capability do we need to build, you know, to improve surveillance? And so, you know, like, okay, the climate on Guam, I know that all of you, you know, there's many, you know, information that's already been shared. You know, Guam is warm and humid throughout the year. Not nice like Hawaii. You know, it's cool here in the morning, it's hot, you know, on Guam. Temperatures range in low 70s to middle 80s. I know that for you who live in the mainland, you know, 70s for us is cold, you know, and so there were a few days in January where it felt like, you know, someone recorded that was at 70, like, wow, it's chilly, but that's early morning, and then of course it quickly went up. And 80s, I think we're in the 90s, you know, it's so hot and humid, you know. Coolest days are in December, February, warmest months, March and August. We had two seasons, dry and rainy, as Dan had presented. So what does climate change mean for Guam? You know, just like, you know, it's been presented, core loss. You know, the concern is how that's going to affect tourism. You know, with 60% of Guam's revenue comes from tourists. You know, so will the tourists come to Guam? You know, if there continues to be, you know, coral loss occurring in our waters. Tropical storms. Guam lies within the typhoon belt. Yes, we all know that, right? We've had 9 major disaster declarations that were due to typhoons. I experienced from Typhoon Pamela to Typhoon Pangsangwa. Our last typhoon was in 2002. And everyone says, wow, that's a blessing. You know, we say we are supposed to get a typhoon every 10 years. You know, we've exceeded that. So what does that mean? What does that mean for us? We are experienced in preparedness. We know the drill. We know when they go into condition of readiness 3. You know, we listen to the radio. We all prepare. Condition of readiness 2. You know, what does that mean for us? Over the years, because of the damage that's occurred to infrastructure, houses, building codes changed. You know, so our homes are concrete. We have typhoon shutters, but yet we have to pay for typhoon insurance, which is expensive. You know, but we can't get, you know, financing without typhoon insurance. You know, so that's something that's, you know, we still don't understand why we still have to do that. But in 2002, with Pangsangwa, you know, it was a different typhoon. At least from a personal experience. My windows in my concrete home with typhoon shutters imploded. You know, so there was a lot of windows, you know, implosion, you know, throughout the island. What happened at the same time was there was damage to a fuel tank, you know, and so that changed. Not only were we dealing with recovery after, you know, and having to look at the infrastructure and try to recover, you know, from that. We also had to deal with the issue of gas shortage. You know, resources had to be prioritized. And at that time, when it came to health, what resonated greatly with me was that we really didn't know our community enough to know where the at-risk populations were, what families, you know, had someone who required oxygen, where the diabetics, you know, resided in the island that needed power, you know, to refrigerate their insulin, you know, and so a lot of these health issues, you know, and concerns came about, you know, through the Emergency Operations Center with everything, all the communications coming into that center. And what have we done from 2002 to today? Can you believe we still don't have a system in place to truly map where our at-risk populations are on Guam? We talk about it, you know, we know that there are, you know, people on dialysis that need to get to dialysis centers. We know that there are people that require oxygen that, need access, to power, and so it's like I just wonder, it's like, what's going on? We haven't had a typhoon, but yet we have these plans. We talk about having plans that are on the shelf. What are we doing? What is our community doing? What are the planners doing? How do we mobilize and sustain, efforts? Our after-action reports, we have all that. We get it. We know what happens. But it's, again, what are we doing to improve? How do we sustain things, on a public health part? As you can see, even with concrete poles, the wind was devastating enough to, result in many of the power lines getting damaged and poles falling down, which the recovery was a little longer, also restoration of water, to throughout the island was also, it took a little longer after that typhoon. Have things improved? I can say that we're having more and more brownouts, power outages today because of, our Cabris power plant, needing, again, repair. So it's, I know our government knows what needs to be done, but it's, what is actually being done, to improve and ensure that we're able to recover quickly after, another typhoon, should that, when that occurs. Rising sea level, coastal flooding. Our port of Guam is, low-lying, and that's where the fuel tanks are located. Rainfall and water supplies, impact of warmer temperatures, that make, of course, what's been discussed. More rainstorms, droughts more intense, but that may not happen right away. What is being done, I can't say, and speak with authority that I know what's going on. Inland plants and animals, the effects on that. For Guam, our coconut trees, we're not worried about typhoons, we're worried about the rhino beetles, damaging that. And what are we doing, to replant, and ensure that we continue to grow coconut trees and not just say, oh, the rhino beetles are taking over, that's it. So what action? As a result, we know what information is showing, what the data is showing, but what are we doing to make, an improvement, for our future? Human health. That's where the link is, right? Climate change and human health, and I guess that's why I'm here. So when I look at the leading causes of death, I don't know if you can see it, but from 2012, we talk about diabetes. Diabetes was at number 4. And then in 2014, it went to 6, 2016 to 7, and then 2017, it's not even the top 10. But you see that cardiovascular disease, remains number 1. And I know that there was a presentation in regards to climate change, and heat strokes and, how that relates. But I don't know about that, whether or not there's any analysis, of that health data, as, correlating to climate change. I don't know. Diabetes, yes, we have, and I know because there's more dialysis centers opening up. I know that there's a lot more prevention. There's a lot more services that are focused on improving health, getting people to be more active, and I can't speak for a fact that attributes to, the decrease, and it no longer being in the top 10 causes of death, on Guam. But it's a concern and remains a concern. Emmy had talked about communicable diseases, infectious diseases in the Pacific region, and she covered that. And this is my reality, increase in the number of TB cases on Guam. So we were doing a great job, to 2013, then we started seeing an increase in TB cases. And at that time, we were seeing also a loss in human resources. You know, we lost a doctor, we lost staff, and so it became more and more challenging for us to implement, you know, strategies that needed to be implemented to ensure that DOT, directly observed therapy, continued, you know. And so, you know, we saw this rise, and we continue to see increases in our TB cases, which are foreign-born. We see an increase in migrants that can come from the other islands as well, you know, to Guam, also being part of our morbidity. We have increase in multidrug-resistant TB. And I don't know if you know it, but Guam had 2 pre-XDR TB cases, which we were told is the first in the North and South Pacific region. And that was a time when trying to get access to needed medication was a challenge. The one medication that cost $35,000 for 188 tablets was not readily available. I had to go through different, you know, seek help from HHS, from CDC to try to figure out how do I get this drug bedaquiline over so they can start the treatment for the pre-XDR TB case. It took me a month, you know, to actually get it, you know, so that person was not in treatment, you know, for over a month. Infectious, you know, not on treatment. So that was a concern. We were able to get that person into the hospital for the first 4 weeks of treatment, you know, until that person was no longer infectious. But now, you know, what CDC tells us is that what's important is that you have to identify their contacts and ensure that 80% of contacts are actually treated, you know, with prophylaxis so that you prevent future cases. Have we been successful? No. So we anticipate that we will continue to have more and more multidrug-resistant TB cases, which again is resource intense, costly. I know there was a information that was earlier presented. I know that the non, you know, just regular TB is at $1,800. You know, when it comes to multi-drug resistance, you know, you're talking about per case, and that's only medications. It doesn't include the doctor, it doesn't include laboratory tests, x-rays, and all the human resources that go into delivering DOT. You know, so this is our reality. So going back to climate change, you know, what's going on in Guam in regards to arboviral diseases? Guam is free, you know, currently free of endemic mosquito-borne diseases. Why? You know, I mean, everyone's like, wow, you have none with the dengue going on around the Pacific Island, Zika, chikungunya, you know, we have migration, tourists coming in. We've had cases of imported dengue, but no locally indigenous. And it could be because, you know, we have Aedes albopictus and Anopheles, but not Aegypti, right? I don't know. You know, I think the scientists here may know more than me.
Did it ever happen?
No. No. Yeah, which again, you know, is interesting, right?
Yeah.
So we continue to build our capacity to improve surveillance, you know, and have capability for early detection. You know, through our Guam Public Health Laboratory, we now have PCR capability that can test for dengue, Zika, and chikungunya. And that's something that we extend to the Pacific Islands. So they can diagnose, you know, and confirm arbovirals in their community so that they could effectuate, you know, timely response. Not only that, but we also have other capability as far as influenza testing that we didn't have before. Remember pandemic influenza, 2009 to 2010? We couldn't confirm it on Guam. We had the hardest time because the airlines wouldn't take any specimens for us. You know, so it was DOD that actually helped us, you know, get the specimen to San Diego reference lab, you know, and was confirmed in that manner. But it took, you know, that partnership, you know, and someone in DOD to have a public health, you know, heart, you know, and say, hey, we'll take that for you guys. You know, we were looking at working with WHO and getting it down to Melbourne, you know, and going that route because we couldn't get it, you know, stateside, you know, but it was a challenge. We have a mosquito lab now that was built with the Department of Interior funds, and so now we're building that capability to identify, you know, be able to identify different species. And again, the goal is to extend that to, you know, the USAPI islands, because it's very costly to sustain. And in that's the challenge. It's always, there's a price tag to that. So, you know, when it comes to climate change, didn't know that our governor actually had established a climate change advisory committee in 2015. And then just last year, you know, the legislature, you know, established a council, you know, on climate change preparedness and resiliency. But as I was looking through that piece of legislation, health is not in it. Yeah, health is not in it. You know, so knowing that and being here, I need to go back and say, ask the question, why is health not in it? I have a lot of question marks, future challenges. You know, we have migration, you know, occurring. We have military still buildup that's going to occur. That's going to impact, you know, our infrastructure, you know, just everything, you know. And what lies ahead, you know, is the question that I have. What role does public health play? I know it plays a critical role. So I'm hoping, you know, to take back more, you know, from here and go back, you know, and share it with my leadership. You know, what happens though is a lot of the research that you do goes to some leaders, but it doesn't trickle down to us who are the ones who develop these programs and implement these programs. You know, so how can we have that better partnership and you know, communication, you know, as many of you have talked about, you know, that is very key. You know, I want to make a difference. You know, Guam is my home. You know, I care about what happens in the Pacific Islands, and I'm sure many of you do. So I hope that from here, you know, there will be new things occurring, and somehow, you know, health will be part of it, and I will, you know, ensure that health is part of all the discussion, you know, moving forward. So thank you.